So, as an ultrasound tech in Canada, I cannot give results to patients. But there are some things that you can look out for as an obstetrical patient that may indicate things aren't totally normal with the pregnancy, or there may have been some findings during your exam. And I'm Kara, by the way. And if you haven't already, please check out the link in my bio for my mom's group for more little insider tidbits just like this one. It is a great community as well if you want a little extra support if you are a current mom or an expecting mom. Anyways, one of the first things that you can take as almost like a red flag is if the sonographer is not showing you your baby at the end of the exam. I think for the majority of clinics, we do the medical part first and then we go ahead and show the baby to the parents afterwards. So if you did not get a look at baby afterwards, then this may be a sign that there was something wrong with baby and it may have been something that was quite apparent and therefore the sonographer didn't show you. Now, this would be kind of a rare case in which the sonographer scanned you and then no radiologist would come in and talk to you, and then you would just go on your merry way without seeing baby at all. That is very rare. But in those instances, I would assume that there is some sort of abnormality with baby that the patient would for sure pick up on, and maybe the radiologist wasn't available to speak to the patient. I don't really know what happens in these scenarios. But if you were not able to see your baby at the end of the scan when it is time for the entertainment or show and tell part of the exam, this could definitely be a red flag. Another thing is if we say that we need to go ahead and speak with the doctor before we show you baby, or if there are obviously some sort of concerns with the pregnancy and therefore we have to go ahead and speak with the radiologist. At that point, you can expect that the radiologist will probably be entering into the room with us the next time that we come in, as in, we do the medical part of the scan, we tell you, all right, so before we go ahead and show you baby, we do need to go ahead and talk to the doctor, and I will be back in a few minutes. So essentially, if there is something that we need to talk to the doctor about, and the patient is expecting to see the baby before that, what we usually like to do is go ahead and talk to the radiologist first in case there is something that they want to say to the patient. And then if they want to come into the room, then they do. A good example of this is if it is a fetal demise on ultrasound. And for the most part, what we do when we don't see a fetal heart rate or we see that nothing has progressed since the last pregnancy and we are checking for viability, we are going to take our medical pictures first. And then we do, or at least I do anyways, give a bit of a heads up or a warning to the patient just by saying, I need to speak to the radiologist. I'm going to go ahead and review the images with them. I will be back. And at least in that sense, it gives the patient some sort of heads up that this may not be as they were expecting. And it's not just us going and leaving the room, not saying anything to the patient. And then the next time we come in, it is with the doctor. And the doctor has to deliver that awful news to them. At least in this way, when I tell the patient that I do need to go ahead and speak with the doctor, I will be back. It does give them some sort of heads up that, hey, things may not be exactly what you had expected today. And then hopefully they aren't just blindsided when we come back in and the doctor needs to deliver some sort of news to them. And with all of this being said, it's not unless it is something major or catastrophic, like if there are severe abnormalities or if there is a fetal demise. Those are really the only times that a radiologist is going to come back in with us to go ahead and speak with the patient. Otherwise, even if there are some abnormalities seen, as in, let's say, baby isn't growing as expected, like for example, in the third trimester, if we are doing a growth scan on baby and we see that there is maybe some IUGR present, we are still going to go ahead and show the baby as is. We aren't going to call the radiologist in to talk to the patient because this is actually up to the job of their doctor, their OB, and in these cases, we will go ahead and send a stat report to their doctor's office so that their doctor can contact them right away. And if it is an abnormality that is probably benign, like let's say we find a two vessel cord on the anatomy scan, it is not going to be a stat report. It is just going to be noted in the ultrasound report. And then the doctor that is taking care of the patient is going to go ahead and relay that information to them, usually at their next OB appointment, since it's not anything that is super urgent. And then they will go ahead and have a follow up from there. And as a last little side note, I feel awful every time that there is something abnormal on baby, especially when it is a huge thing, like baby has no fetal heart rate, and it is not something that we can go ahead and tell the patient. I can't tell you how many times I have scanned somebody who maybe knows something is wrong or has some sort of gut feeling, and when they ask, does the baby have a heart rate or a heartbeat? and I can't say anything. I just need to tell them, well, I'm actually just needing to take a few more pictures, and then I will go ahead and talk to the doctor after this. The fact that we can't even tell them, no, there's no fetal heart rate, and they have to sit there and wait. Like, I can't imagine the agony or just even that uncertainty that the patient is feeling in those moments where I am trying to finish up the scan and then having to go talk to the doctor, and they're waiting for the doctor to come back in and talk to them. It's obviously one of the worst parts, I think, of our job, not being able to tell the patient what is happening in that regard. But at the same time, I also get the hierarchy of things. I absolutely do agree that we need the radiologist to come in and deliver that news, and it is absolutely not our place to go ahead and tell the patient that. But on the other hand, if a patient is nervous about their exam and I do see the fetal heart rate right away, I will turn the screen at that point to show her before actually continuing on with the exam, because again, why make the patient wait and just have it be a whole thing when I could just go ahead and turn the screen, show her that yes, baby has a heart rate. Now I'm just going to turn the screen back to me and I'll finish up the exam, instead of, I guess, her waiting for that whole time just for me to tell her, yeah, it's there. Anyways, that's the other side of the coin, is it's not like it's easy for us either, for a lot of these cases, to have to keep this to ourselves and then having to talk to the doctor after for them to then come in and talk to the patient. But either way, we are not allowed to give results, but you can look for a few of these subtle signs that maybe the exam isn't going to go how you expected. But also, as a little disclaimer, I know that some places, and I think this is few and far between, they don't really give a good look at baby at the end. At the clinic where I work, we make sure that we always show the patients the baby at the end, basically from head to toe, if it is an anatomy scan, and show them the baby on the screen with the fetal heart rate if it is a first trimester scan. But in addition to that, we also print off a picture for them and text them a bunch of pictures. And I know this is not the normal at some other clinics, so take it with a grain of salt if the sonographer isn't showing you the baby for a long time at the end, or if you feel like you were maybe gypped out of a show. I think that might also just be the sonographer. But like I was saying in the beginning of the video, it's more like, okay, you didn't get to see the baby at all, and there was really no indication that you are going to be able to see the baby. That could be a red flag. It could be because the doctor is going to send a stat report to your doctor and they didn't want to actually come in and talk to you, as in the radiologist on site, and therefore you did not see the baby because it might not have had a heartbeat, or there might have been some huge structural abnormalities. But with all that being said, that also may not be the case. It might just be one of those one off clinics that don't show the patients the babies. But, anyways, wanted to put that in as a little side note.